You've been out here on the picket lines this morning. Tell me what the mood is on this third day of action.
I think what's been so fantastically incredible, what's been so incredible today has been seeing not just junior doctors, seeing patients, seeing medical students, seeing so many people from other professions, teachers, etc., all here on the picket lines with us, all supporting the cause because they understand that we're fighting for the future of our profession today.
And what's the what's the public response like?
The public response has been absolutely overwhelming. We're hearing, cars honking their horns, cheering support, cheering us on, telling us they appreciate what we're doing as they come past, bus drivers, cabbies, members of the public, and it's just been so fantastic to see and really reinvigorated so many of these doctors that have faced that hammer blow of knowing that this government, regardless of all of the concerns that have been expressed by ourselves and so many of the profession's representatives and frontline staff, that they're going to force this contract through even though they don't really understand what it will mean for them.
How many strikes do you think it's going to take to make this government backtrack?
So no doctor wants to strike. It's not why we started in this profession. It's not what I want to be here doing today. What I want to do more than anything else is go back inside the hospital and go back to work. The problem that we have is that this government is forcing through something that will completely undermine the sustainability of our health service. We are already seeing huge numbers of doctors deciding not to carry on their training. 10 times the number of doctors on the day of imposition applied for the paperwork to leave the country. I think we're seeing a service that is already stretched to the absolute limit. We don't have the staff to actually provide the service we have now, let alone what the government is saying they want to do. I think we're facing a real challenge now, and doctors are unfortunately taking the only action left available to them to change the minds of a government that just don't understand the threat that they're posing to our profession.
Obviously this is an escalation. You've gone from 24-hour strikes, 48-hour strikes. Where'd you go next if the government don't back down?
I mean, I'm absolutely terrified that this government will continue to be, so obstinate. It's terrifying to think that we could be taking further action. It's terrifying to think that we're taking the action we are now, because it's not what we want to be doing. We have tried everything to try and get this government to see sense, to negotiate, to find a way of, finding a real solution. We made an offer to them in the negotiations that allowed them to achieve what they were trying to do without compromising the service that we want to provide. And they just aren't interested. They're more interested in trying to score political points than they are a realistic solution.